I'm Serene, one of the scholarship officers with Healthcare Scholarships and Talent. To start off, a warm welcome to Day 7 of the Healthcare Scholarships Virtual Experience 2021. For some of you who have attended our earlier sessions, welcome back and thanks for joining us in this segment. Throughout the 2 weeks of virtual events ending on 3rd March, you'll get the opportunity to participate and interact with scholarship officers, scholar ambassadors, university partners, and professional representatives from various public healthcare institutions. Do note that there's an ongoing leaderboard and game section for participants to win attractive prizes, such as Universal Studios Singapore one-day pass, Disney Plus subscription, GrabFood vouchers, and many more. So welcome to Dare to Care amidst the pandemic, a COVID-19 sharing. The COVID-19 pandemic is the defining global health crisis of our time. Join us as frontline healthcare professionals share about their work and why they still dare to care during the heat of the pandemic, challenges faced, and how they are coping with the new normal. For today's session, we have 4 frontline healthcare professionals who will be sharing, and we would like to warmly welcome Mr. Chi Zhao Li, Deputy Director, Product Management and Delivery Group 3 Backroom Operation Systems from Integrated Health Information Systems, Ms. Ho Hui In Agnes, Senior Staff Nurse 2 from Tan Tock Seng Hospital, Ms. Lee Yun Ray Giselle, Assistant Nurse Clinician, National University Polyclinics, and Mr. Aloysius Chan, Physiotherapist, Singapore General Hospital. Before we begin, if you have any questions for our speakers, please feel free to type in your questions in the Q&A functions. And if you would like to direct a question to a specific speaker, please kindly indicate it into your question. Lastly, if you see a question that you're interested in being answered, please upvote the questions. And a gentle reminder to ask genuine questions for our speakers. So I would like to pass the time over now to Mr. Chi Zhao Li. Zhao Li, please.
Hi, good afternoon, everyone. Okay, let me just share my slides here. Hi, good afternoon, everyone. My name is Zhao Li, and I'm the Deputy Director with IHIS overseeing teams in providing support to systems like the real-time location system, the biomedical equipment system, and the risk management system. Together with my team, we are providing support to all the 3 clusters like SingHealth, NUH, and NUHS, as well as the agency like AIC. So during the COVID operation, I was providing support to the CCF as a Chief of Staff in the command center. So who is IHIS? So IHIS is the IT service provider for cluster and agency for all the 3 clusters. And we are providing the support to SingHealth, NHG, as well as agency like AIC. We are actively involved in the planning and execution and support of all systems in the hospitals. So IHIS is the largest health tech company in Singapore with a strength staff of close to 3,000, and we are still growing. And we have undertaken about $700 million of projects every year. And we are supporting about 800 systems to ensure that the hospital is operating fine. And we are the powerhouse behind the scene supporting the hospitals. So IHIS involvement in the CCF settings. There are about 7 CCF across the Singapore. So IHIS involved in enabling 6 out of the 7 CCF across Singapore. So IHIS was very involved in making sure that the systems like the vital sign monitoring systems are integrated with the GP Connect and NEHR for retrieving the patient information. IHIS was activated at the early stage of the pandemic, and we were given very short lead time, as short as 5 days to get things up and running and be operational ready. And we didn't have the luxury to start off with building new systems to cater to the operation needs. And as such, we had to look at all the existing systems and then retrofit them as minimal viable product. This MVP is not prototype but are actual working systems. And these MVPs were rolled out and were constantly and rapidly evolved to meet the operation needs of CCS. To able to support the operation, IS teams were deployed and seated closely with the medical team and operation team. We will meet up with the team at least once a day to understand the change needed, and we will promptly respond to meet all these operation needs. A lot of fundamental work was done when we set up the first 2 halls, and we were able to tap on this experience. We proceed to open up more halls. This experience were able to be used to replicate to set up other GTF at Tuas and Bbox. IHIS recognized that there are 3 key system requirements at the end of at the start of CCF operation, namely the need for speed to develop and deploy, the need to integrate with existing system, and the need for ease of use of the systems. As such, we have developed a simple portal for operation teams to onboard patients to the system. And this portal was integrated with the GP Connect, which in turn was integrated with the NEHR. The patients were given the access to the vital sign monitoring system to enter their own vital sign so that the medical team are able to monitor their health. To date, CCS solution has been used extensively, and we have collated about 27,000 patient records with 1.3 million VSM readings and up to 90% compliance. So these operations were supported by more than 700 VSM kits and kiosks with 80 plus training sessions to the users. And up to date, we have about 50 enhancements to the system to meet the operation needs. Okay, we face a lot of challenges at the start of the operation, and one of the challenges is that because at the start of operations there are multiple sources of information coming to the operation center, so we end up with different information with inconsistent of the patient's names and things like that. So this has created unnecessary operation administrative overheads for the teams. So in order to resolve that, we actually quickly create a single source of onboarding list so that this common view is maintained for all parties involving in the operations to manage the incoming of the patients. Another challenge that we face is that because we set up the hall 3 without knowing that there are so many patients coming in. So at the start of the operation, we actually issued individual VSM kits to the patient. At the maybe 2nd or 3rd week of the operation, we realized that there are more and more patients coming in. So we have no choice but to cut down the number of kiosks issued, and then we go on to issue about 20 VSM kiosks per hall. But that doesn't really solve the problem because of the difficulty to deploy and to maintain the equipment. As such, in the version 3 of the deployment, we actually mounted the VSM kits like blood pressure reading and the heartbeat monitoring onto a table with wheels. So we call this telehealth on wheels, and this can be assembled and configured and tested in the green zones before being built into the patient areas, which we call it red zone. And we have quite a number of standby telehealth on wheels equipment in the green zone. And if there's any need to sort them out quickly, we will just push in the good equipment and then take out the bad equipments. And then when we move on to the big box, right, we actually put in more security, like securing the equipment to the table so that the equipments will not be lost. So we are prepared and ready. So all systems at the CCS are now put on a cold standby, but we have all the standard procedures in place and defined, and all the equipments are all fully configured. We have the training materials all developed, and we are always ready to train the trainers again, and we are able to mobilize within 24 hours and get ready to run the operation within 48 and 72 hours. In short, we are ready to manage another pandemic if there's one. Yeah, that's all I have to share today. Thank you.
Thank you, Zhao Li. I'd like to pass on the time to Agnes. Agnes, please.
Okay, thank you very much. So, just like to introduce myself. My name is Senior Staff Nurse Agnes Ho, and I'm from Tan Tock Seng Hospital, the National Health Group. So, thank you so much for spending some time to listen to my sharing on the COVID-19 pandemic. And before I talk about some interesting stories that I encounter during my work, just let me give you a brief background of myself. So, I actually graduated from Ngee Ann Poly with a diploma, and subsequently, I got a scholarship to study my degree in the Singapore Institute of Technology. So I've been working in Tan Tock Seng for about 5 years now, and I've been to various departments. So when I started out, I was in the surgical high dependency unit where we nurse patients post operation. Subsequently, I got transferred to the coronary care unit where we work with patients mainly with heart conditions. And I went on to pursue an advanced diploma in critical care, specializing in caring for patients with ICU. So currently I'm in the medical intensive care unit for about a year plus now. And mainly we nurse patients with respiratory conditions here. Okay. So this is actually a picture of me just coming out from a patient's room. So after I remove my personal protective equipment, we call PPE, right? You can see my hair is quite messy. I took out my goggles, so there's a mark on my forehead and I'm on my N95 mask. So thinking back about the COVID-19 1 year ago, so during that time in January, most of the patients are actually housed in the National Center of Infectious Disease, which is the NCID. So I'm actually working in the main Tan Tock Seng Hospital, which is just a one road across the NCID. So at that time, the management saw that there will be a surge in patient load, and we need more beds and places to house these patients. So the management actually started to revamp some of our wards. Okay, and one of my ward, the ICU, is actually turned into outbreak ICU. Okay, so in the outbreak ICU, we mainly nurse patients suspected of COVID-19 infection, or they have the COVID-19 infection. Okay, so at that time, a lot of changes is going on, and everybody was like just learning together. It was very, very tiring because there were so many protocol that is changing every day. So we work 3 shifts, like morning, afternoon, and night shift. So you could be coming in on day 1 on your shift, and you realize that, oh, the protocol is at version 1. But then 2 days later, when you come, the protocol may be on version 5 already. Yeah, so there's always constantly learning. And also the infection control department has already started teaching us to don the PPE properly and to doff off, so we don't want to bring the virus back home or get the virus, contract the virus ourselves. So there was a lot of a fear of the unknown, because all of us do not know the COVID-19 virus, how is it transmitted, how sick can a patient get if they got contracted with the COVID-19 infection. So there was a lot of worrying going on. Everybody didn't know what was happening. Everybody was just going every day, one day by day. So taking day by day. So there was already a lot of mixed feelings there. And as you can see, this is the smaller picture. It's me in a PAPR. So it's a suit where the air get purified. It's a respirator. So it's like an added protection that we can wear if we want to nurse the COVID-19 patients. So at that time, there.
So sorry, Agnes, you're
Yes.
not showing your slides.
Oh, is it?
Yes.
Oh, okay. Just a moment.
So sorry.
It's okay. Can you see it now?
No.
Okay. Just a moment. Okay. Can you see it
Okay.
now?
Yes. Could you put it full screen, please?
Oh, yeah. Do I have to go back or?
No, I think it's fine. Thank you.
Okay. Yeah. So sorry for the technical fault. Yeah. So the smaller picture in the middle is me in the PAPR lah. So as I mentioned earlier, so it's a suit where actually air gets purified and we can use as an added protection for it. And at that time, right, a lot of nurses is needed. So nurses who are not in clinical, who are not on the ground, actually came back to help. So there were a lot of nurses deployed from different places like the high dependency ward or actually the general ward to come and help. So at that time, right, I really felt that there was really good teamwork and very good camaraderie between all of us because everybody was worried about the infection. Everybody do not know. We didn't want to bring our virus home. We don't want to contract the virus, and a lot of us have like young children or older parents or grandparents at home. So and also we want to nurse our patients as best as we can. Yep. So just share a few different stories and that I have while working during the COVID-19 in my ward. So this is a picture of a kidney dish with a lot of resuscitative medications. So I remember there was this patient who came in from the emergency department. He was very, very sick. He was suspected of COVID-19. So we actually have to don on our protective equipment and then we went in to nurse him. So his oxygen level wasn't very good at that time. So when he got transferred to the ICU and we transferred him to the bed, we realized that the heart wasn't beating, slowly dropping. So we actually checked the pulse and I realized that his heart was not beating at all. So immediately I pressed the emergency button and then I jumped on the bed and started CPR for him. So my shifts actually, I was on PM shift that day. So it was a 1 p.m. to 9 p.m. shift. He came in about 2 p.m. And when he came in, right, we started doing CPR for him. So in the short 5 hours, right, his heart actually stopped for about 5 times. And with the PPE, the goggles were fogging up. It was very hot inside, but we try our best to actually do as best as we can to resuscitate him. But after 5 rounds of resuscitative efforts, unfortunately, he didn't make it lah, and he actually passed on. But so that was quite sad at that time. But the thing that saddens me was his family wasn't able to be there by his side because he was being quarantined at that time. So and that time was circuit breaker, so no visitation was allowed, number one. And his family was not in Singapore. It was across the borders. So I actually did a video conference for them, and it was very, very heartbreaking to see that the family was crying through the phone, looking at the patient, and there's nothing that I can do or they can do about it. So moments after we hang up the video conference, right, the patient actually passed on. And yeah, so that was one of the patients that I nurse. But not all resuscitative efforts are futile. There are instances where we do our best and patients actually got better. So the second case that I want to share with you is this Mr. Raju. He's actually the early COVID case number 42 lah. He's a Bangladeshi who was critically ill early on in the COVID-19 infection. And then initially he was housed in the NCID, and subsequently he got transferred to the main Tan Tock Seng. So I actually got to nurse him for about a month plus. So at times, so he was still very critically ill at that time when he was in the main Tan Tock Seng hospital. And at times we thought that we didn't know that whether he could make it or not. But as nurses, we believe that the hearing is always the last senses to go. So every time we do a bedside nursing care for him, we actually encourage him, tell him to get better, to as his family is waiting for him and he has a newborn child waiting for him at home. So just one day he suddenly got better and he got transferred to the high dependency, the normal ward, and then did some rehabilitation. And after 5 months of fighting the COVID-19 infection, he actually got better and he is able to get discharged from the hospital. So that was a very heartwarming story lah that I've encountered. And actually recently, about a month ago, right, my institution has actually a event where they actually recognize the hard work of the frontline staff and also share stories about COVID-19 infection survivors. So Mr. Raju actually really came down to the hospital to thank some of the nurses who have really nursed him. And I looked it through the video, and it was very heartwarming to know that after so much effort that we have done, right, he is now able to live his life, walking around, and then knowing that he can still be with his family. Yeah. So to me, right, being a nurse is so much more than just doing bedside care. So as we nurse the patient, we are always there 24/7 with the patient. So it's kind of like very, very holistic care. So we are like the doctor, because every changes in behavior or condition in the patients, we are always the first to know, and we are always the first to highlight to the doctors. Secondly, we are like the pharmacists, because day in, day out, we give medications. So we need to know the medications very well also. And definitely we're like the caregiver, because we do bedside care, we turn the patient, we spend time with the patient. And also we are kind of like the dietitian, because we actually ensure that the patients get enough nutrition. All in all, also, just a moment. So we are also like a social worker. We not only tend to the needs of our patients, but also the needs of their family members, because a lot of times when patient got critically ill and got transferred to the ICU, it comes as a shock for the family. So helping the family cope is also one of the areas that we need to tend to and look into lah. And for nurses, we also need to look into other needs, and if needed, we can actually refer them to like the therapies, like the physiotherapy, speech therapies, or the occupation therapies if needed. Yeah. So, but being a nurse, we don't only do bedside care. There's so much more that we can do. Okay, within the hospital itself, there is a lot of opportunities to be involved in projects, and quality improvement projects. And for me, myself, I'm very fortunate to be able to have the opportunities to work with nursing leaders to help to improve processes, to provide and deliver better care for our patients. And also got the chance to meet fellow Tan Tock Seng colleagues, okay, so that we can learn. And I realized that there are so many, all the nurses are so talented, and there are so many things that we can learn from each other. And also we have many opportunities to meet enthusiastic nursing students, because we can see many passionate young students now are actually looking at nursing as a career. So nursing career opportunities, really the sky is really the limit. There's so much areas that we can actually explore. So while we are working during the being a staff nurse and senior staff nurse, we can really think through what we want to do in the future when we progress in the career. So if like someone is interested, a nurse is interested in doing bedside care, continue to deal with skills and patients, we can actually look into pursuing to become an advanced practice nurse or a nurse clinician. Okay, or if you like administration or management role, you can aspire to become a nurse manager. And if you are passionate in teaching young new nurses, you can actually pursue a career in nurse education. And in the recent years, there's more career tracks that is coming up. So in my institution, there are roles like a nurse researcher, nurse scientist, if people are interested in research. And also if they're interested in informatics, they can pursue a track in the informatics track. So nursing is really a national agenda, and in recent years, right, there's this care for nurses coming up lah. We really want to recognize the efforts of our nurses, okay, and want to upskill them, okay, career development, to help them to go for courses, to upskill them, giving them more autonomy, to empower them to learn new skills like technology and also decision making. And also we have a lot of scholarships out there which help our nurses to advance their studies, like degree or masters. So if you are interested, you can actually look through the websites and all. Yeah. So before I end my presentation, I would like to I remember this quote from our group chief nurse, Mr. Yong Keng Kwang, that he said that if you find your way into nursing, right, it is most likely you will spend your lifetime in nursing itself. And I find this statement very, very true. Although sometimes our profession may be very, very busy, and I'm not gonna lie, it's gonna be, sometimes it is very tiring, mentally, physically, and emotionally challenging. But at the end of the day, right, the fulfillment we get is really so much more. Like when a patient just say a thank you, a smile at you, or even a daily interaction with the patient really, really helps me to look back into the reason why I really joined nursing. And that is what makes me stay in nursing. Yeah, so with that, I end my presentation. Thank you so much.
Thank you so much, Agnes. I would like to pass on the time to Ms. Giselle. Giselle, please.
Okay. Hi, good afternoon. My name is Giselle Lee. I'm the infection control nurse working at National University Polyclinics under NUHS.
Sorry, Giselle, your slides are not up.
Yeah, let me share my.
Okay.
Let me see this. Are you able to see the slides?
Not at the moment.
Okay. I have clicked on the sharing. Okay.
Yes, do I need you to put full screen, please?
Okay. Let me try. Okay, as an infection control nurse, I mainly help to direct and coordinate infection control program in polyclinics, and I also review and update the skills checklist for the competencies assessment. This is to make sure we have the latest established standards in place. And frequently, I also act as a resource person or advisor for all the staff in our polyclinics. As an infection control nurse, right, we have common understanding is that there's uncertainty as unexpected events may happen, such as the outbreak of the infectious disease. Sometimes actually is currently happening to us, such as the COVID-19. Yeah. So even during non-working days, right, we are actually prepared to be 24/7, you know, for receiving any of the consult or any of the message, asking advice at times. Therefore, we also, because we always look for the improvement in our practice, therefore we also participate in research, mainly in the interest of the infection control. For myself, I have lead the infection control projects. Last but not the least, we also develop many training material to educate our staff, such as the current COVID-19. We have developed a lot of new education material because this is different from the previous situation, and the training should be also different. Yeah, so today I would like to share my experience during the COVID-19 pandemic last year. At the start of the COVID-19 in January to February last year, our NUP staff have already started wearing the PPE on 22nd January. And on 31st January, we have started our first medical consult provided for person under quarantine. So as an infection control nurse, right, we have to ensure at the start of this pandemic, to ensure all the staff are being mask fitted. And for our side, this is not a problem because we have been conducting our mask fitting session every month. And for all the new staff that join us, we always conduct the mask fitting also. So we just check through and whether there's any remaining staff that actually forgotten or missed out the session. And we also quickly check the PPE competency for all the staff, because PPE competency is a yearly exercise. However, we bring forward during last year, end of January, we finish it within the 7 days. And at 8th of February, NUP activates the DORSCOM Orange plans after MOH has activated DORSCOM Orange Alert. We initiated the red zone and green zone, which is not our usual practice, is a new thing to us. So the red zone is mainly to accept the visitors coming in with the URTI symptoms and with positive travel history. So this arrangement is not easy because every clinic we have to divide to red zone and green zone. So this involves the teamwork of our clinic heads, the operation team in the clinic, and the nurse managers, and also our infection control team. So we have to ensure we can arrange the best based on the current situation and on the specific clinic space and also the manpower. So this is to ensure the arrangement of green zone and red zone can prevent any cross-contamination and also to prevent cross-transmission with the new flow. On 18th of February, our NUP started swab and send home, which is SASH in short, and full subsidy for in all our polyclinics. Yeah, talk about the mask fitting and PPE training. Often when we're talking about infection control nurse, right? So we will talk about they are always doing mask fitting, they are doing the PPE training. Yes, we have done a lot of training and mask fitting during the early period of COVID-19. As preventing the transmission of infection is a key strategy in outbreak management, the need for effective PPE, PPE is the personal protective equipment, and how the staff can use it effectively is a critical issue to all our staff and our volunteer workers, the doctors, nurses, and the community that we support. Yeah, so since end of the January when the COVID-19 started, besides completing all the PPE training and the mask fitting, we also have to assist to do the mask fitting for the general practitioner, the GPs from the clinics under primary network. And that means the GPs are actually going to the clinics to have the mask fitting done and the PPE training done there. And besides that, as the number of the GPs are a lot, so we are doing a lot of mask fitting and PPE training outside of our polyclinics. We went to different locations. We conduct the mask fitting there because the number of the GPs are a lot. So at the time, we even did the refresh PPE training via Zoom because we need to maintain the safe distancing during that period. Not to forget our PPE training for the housekeeper also, because in healthcare setting, our housekeeper plays a very key role in maintaining the infection control. So it's also happened at the start of the COVID-19 at the end of January last year, we quickly arranged a refresh training for our IS supervisors. This is to prepare them for them to train their housekeepers for the upcoming pandemic. Yeah, this have also given much reassurance to our housekeeping staff, especially during the time a lot of things is uncertain. So overall, for the mask fitting and PPE training that our team have done, right, is more than 1,000, more than 1,000 people. Next, talking about the SASH. SASH is the swab and send home. So we have a lot of community public. They are coming to the clinic to do the swab for the COVID-19. As the swab the number of the swab increase, so we don't have enough manpower to deal with the increasing number. So at that time, we actually train our dental team, our dental staff, for example, our dental officers. They work as a swabber, and our dental assistants, they also being trained for the enhanced PPE and to help in the clinic. So we work with the education team to teach them the swabbing and also the right way of donning and doffing, that means putting on and taking out the PPE safely. At the mid of April last year, we have with the launch of the iConnect COVID. It is the MOH initiation. So this iConnect is a collaboration with MOH Office for Healthcare Transformation, the MOHT and IHIS to improve tracking of swab and serology results. So with that, right, we actually started to receive the referral from the GPs outside for the SASH, the swab. And we also have the deployment from HPB team as the swabbers. Yeah, this is the support from MOH. Due to the number is keep increasing. So for the HPB team, right, we have to ensure they are all mask fitted, and the mask fitting, the donning of the mask is correct, and the mask that they are fitted that is available in our clinic. So we have gone through one more time, and to ensure also they are putting on PPE and taking off PPE is the right technique. So we have to train them also. And as for the SASH, the number of the swab we have done in the clinic, for last year, there are more than 51,000. And as for this year, there are more than 13,000 as of 23rd February this year. And besides this swabbing in our own clinics, last year during the first 3 months of COVID-19, when there's a cluster of COVID-19 discovered at the dormitories, our NUP also started to deploy our staff to the dorm with the medical and the admin and the nursing staff. And we also set up the medical posts at different dorms. And subsequently, as the SIF is the swab and isolation facilities is increasing. So our NUP was tasked to take care of 4 SIF, which are Dorset Hotel, Grand Park Hotel, Farrer Park Hotel, and also NTU. So these 4 SIF, how do we deal with this extra responsibility? What we do is we actually have one clinic to take care of 1 SIF, whereby the clinic will deploy the medical and nursing and admin staff. Admin staff, we mainly have the support from the NUHS Regional Health System Office. So we have our nursing and medical staff there, and we also have the volunteer doctors and nurses from outside. So what my team need to do is we have to ensure all the staff go there, they have the good infection control practice, they have the good technique on putting on the mask and the gown, all this. Other than that, the more challenging one is that we have to train all the hotel staff and the NTU is the school staff there with the knowledge of mask fitting, we do the mask fitting for them, and with the knowledge of the PPE, why we need to put on in this sequence, and why we need to, take it off according to the sequence and the hand hygiene. So unlike our healthcare workers, because healthcare workers have been familiar with that, because even before COVID-19, we have been doing that. So for the hotel and the NTU staff, right, we have to teach them from the start. Yeah, so we did the mass training in all these 4 SIF before the operation. Besides that, we also conduct our infection control audit, because after the training, we need to ensure they remember and they do it every day at the right technique and the right practice. So we conduct the audit is to ensure this is sustainable. Last but not the least, I would like to share my experience when I was doing the infection control audit at the dorm site. I was together with the mobile team at the dormitory, at Space at Tuas, and also at the Jurong apartment. The mobile team is set up at NUP, whereby we have our admin staff, our doctor, and our nurse form the mobile team, because the mobile team meaning that we are going to, every day we go to different place, we bring all the equipments there. So after going there, the doctors and nurses and admin staff will just, set up the stations accordingly and do the swab according to the list of the foreign workers provider. So do all the swabs for them. After that, then they will review some of the cases which are no symptoms or have very, very mild symptoms. The audit there really impressed me is that, as you can see from the picture, it's actually after the whole process, one of the doctor took out the goggles and took out the gloves, so you can see the sweats are dripping on the floor. So this is really impressed me, because at the dorm site is very different from the SIF that I mentioned earlier on, because the SIF are mainly indoor and mostly like at the hotel environment. So unlike that hotel or the indoor environment, the dorm site is really very hot. So all of us are wearing the full PPE. So during that few hours of work, right, actually inside is sweating a lot already. So the hands are soaked in the sweats. But however, what I observe is that the operation there is very systematic, and the staff are very familiar with the process, the workflow there, and they are very passionate because everything done very nicely, and they are also give a very clear advice to the dorm site, the foreign workers, so they are reassured after being seen by them. Yeah, this really touches me, and I was very proud of the team with such professionalism and passion. Yeah, with that, I will end my session. Thanks for listening to my sharing.
Thank you, Giselle, for your sharing. We'd like to pass the time over now to Aloysius. Aloysius, please.
Okay. Hello, everyone. I'll start sharing my slides.
Sorry.
Sorry, I can't share the slides. Giselle, can you help me to stop share, please?
Sorry, it's still my slides, is it?
Yeah, thank you.
Okay, let me see. Actually, I have already stopped. Okay.
That's better. Thank you. Okay, good evening, everybody. My name is Aloysius, and I'm a physiotherapist with SGH. So before I go on and start sharing about my experience, which is going to be a bit different from Jowli's, Agnes, and Giselle's point of view. I would like to say thank you to everybody for attending, and for Jowli, Giselle, and Agnes, thank you so much for being the MVPs of this situation as well. I think compared to the allied health professions, you are even more advanced than us. So for those in the audience, I'll be sharing, I think there are some of my hall members in the audience that are listening to these presentations as well. So you will see your pictures coming up soon now. Okay, so today I'll be sharing a little bit about my COVID-19 experience back in 2020 and how everything has changed. So before we go on, I just like to give some information about myself. So I'm actually a MOHH midterm scholarship recipient. I got my midterm scholarship back in end of year 2 towards the year 3. And I graduated from the University of South Australia in 2015 with honors. I joined SGH in February 2016. So today and the next couple of days is actually my fifth work year anniversary already. So it's been 5 years since I started work. Why I chose to be a physio is that I have this dying passion to help people. Back when I was younger, there is this thing where if I don't stop to help, it just feels very odd, very awkward to me. And when I do share that help, when I help somebody, it's very rewarding and I can make that small little impact in somebody's life. Of course, being a physio or being a healthcare professional, there are many new challenges. And this is something that I do look forward to every day when I come to work. Okay, and lastly, the word thank you. Thank you is something that it can be said very easily, but when a patient actually tells me thank you, or even a healthcare staff, a colleague tells me thank you, is something that just cannot be explained. It really warms my heart. A bit more about my schooling life is that I just want to clarify all the doubts for all those new scholars or all those new students that are planning to join the healthcare setting, that there are a lot of things to be done when you are studying. So attending lectures, tutorials, camping in the library the whole day, going on your clinical placements, then you need to buy food, go back home, and of course, spend time. But most of the time, actually, you are spent studying. Okay, so probably 80-85% of the time is trying to study because it's quite a world of difference from your JC, from your polytechnic times. And for incoming physios or those who are wanting to become a physio, this will be your best friend. Okay, why I say so is that you spend most of your time trying to practice the techniques. So if you see on your right hand side of the screen is my friend. Okay, that's my friend back in Australia. Yeah, so we are practicing manual techniques of the neck. I blurred him out because his face just looks terrible. Okay. And back when I started work, what I thought was that I would just come from home, see my patients, go back home. But actually, there's a lot of role as a physio. So you have multiple projects to improve patient care. So you run qualitative improvement projects, you do your research, all this. There are many meetings to attend. So nowadays, because of the COVID-19 situation, all meetings have been done virtually. It's actually good and bad. Okay, good thing is that you can just stay in your room it's a luxury. Can also not see some colleagues if you don't want to see them. But the bad thing is that you lose the face-to-face interaction and being able to experience the body language of whoever that's attending the meeting. There's also a lot of administrative tasks. So for example, if we see our patients, we have to do our documentations, we have to read the case notes. So all this takes time as part of our working day. There's a lot of self-learning, a lot of research, and doing presentations to improve your clinical care, to share the knowledge among your colleagues. Lastly, treat patients, okay? But what school and what work didn't tell me was that how we would actually, or what we will be doing during a pandemic. So this is something that I think most of us were not prepared, except those a bit older who had experienced the SARS pandemic. So when COVID-19 came out, it came out late January, just before Chinese New Year, my first thought was like, oh no, or OMG, what am I supposed to do? Okay, what is going to be my role? How will this affect my job? Okay, it was my 4th year of work back then, and I wasn't too sure how the year will fan out. Okay. However, as the months passed by, there were many changes, some positive, some not so good. So we had our annual leaves cancelled. A lot of us can't travel overseas anymore, had to start keying in our temperature 2 times a day. The only thing that really caught my attention back then was the call for volunteers to be sent to help the outbreak in the dormitories. When that first came, the first thought was that I didn't have a lot of patience back then. So if nobody went, why not I volunteer myself? And to my surprise, there were actually a lot of my colleagues or a lot of my close friends that actually volunteered together. And we all went as one whole group of friends. Okay. So I was deployed to the community care facility at Singapore Expo, Hall 10, for a period of 2 months over May to June. Back there, I was working as part of a multidisciplinary team, trying to admit the residents, take care of them, getting them to key in their vitals 1 to 3 times a day, engage them by playing games. And if you can see on my slide over here, I was teaching them how to wash their hands. So something that Giselle is trying to enforce to every one of us. So I was trying to share the knowledge with all my brothers. So back in the hall, everyone, we don't really know their names. There are thousands of them. So everyone is just brother. They call me brother, I call them brother. So it's all the same, okay? A little bit more is that I think when the slides came out with all the full protections, personal protection equipment that we have to wear, is very sweaty. So here you see a picture of me. This is actually one of the better days. On the days that are not so good, I'll be soaked in my pants as well. So usually I need to change my clothes 3 times a day over a 12-hour shift. 3 times is actually the bare minimum because it's really very sticky. Your hands are all creased up. You can barely even feel your face, your goggles, all this are already all fogged up by the end of 2-hour shift inside there. Also, Ziplocs. Ziplocs are actually our best friends then. Everything is all Ziploc. Your staff pass, your handphone, everything is all protected in the Ziploc. So this is my sort of my gear when I actually was deployed to Singapore Expo. Everything packed in the bag. Then when I go there, put it in the locker. When I get home, I will spray it down as well, wipe everything down before I enter my house. The thing is that with going out to take care of these residents, there's of course its challenges with my family members. So I'm thankful that my family members were very supportive of me. The only thing was that before I could even talk to them, I had to shower myself. I had to wash my clothes first before I could even sit down on the sofa. So that would probably take me 20-30 minutes. And with the shifts ending at 8 p.m., I would probably sacrifice some of the family time that I had back then. However, you sacrifice some of your own family time, but I'm very thankful that I made a new bunch of friends or family. So these are my hall members. So this comprises of nurses, executives, social workers, radiographers. Okay, they all come from different areas, but all with the same intention, just to take care of the residents, to work together as a team. So back then, what I really liked was that there was no hierarchy structure, unlike in the hospital where you have to call the doctors by doctor or call the nurses by like sister. Back there, we all call each other by name, of course, showing some respect as well. But this is something that I really enjoyed at the point of time. We all were technically on the same level. We didn't know what was going on. Every time we came to work, there was a new change. But it was because of all these people that we managed to pull through this couple of months to help with the pandemic, to take care of the residents inside the hall. And being a physio, okay, besides helping the residents, I also need to help my colleagues down there, right? So of course, we also run exercise sessions inside there. Okay, so here is me and my other hall members trying to exercise. And of course, being physios, we have the ability to modify them based on their functional status. So some of them had some joint problems. So we changed it so that everyone could engage. And this is part of a pre-dinner routine that we enjoyed together. We try to keep everybody active, maintaining your work-life balance while still under quarantine. Okay, so or while still being deployed out to the hall itself. The good thing is that we still had some social interaction. So rather than when I was in the hospital where everyone was supposed to stay at home, it was a circuit breaker period. This is something that I thought it was a bit better than being in a hospital setting. Okay, and lastly, this is a picture of the group of my fellow physios that were all deployed with me. So it was really nice to see the bunch of us enjoying our time despite the challenges that it felt. But the social interaction, the teamwork that we all had. It was something that, I mean, it's very hard to explain, but if I were to put it in a sentence, I would say that I'm glad that, okay, I wish that this didn't happen, but I'm glad that it happened. Because without this, I think we couldn't really take a step back in our work to really reflect back at how we can improve our clinical care, but also take a nice break to contribute to Singapore's care for this pandemic itself. Okay, and another picture of our group members. So before we are entering the hall, we take this time also to really check each other's personnel protection by making sure our gowns are fully covered. We are gloved up properly, our mask is placed on properly, and we are fully protected before we even enter the hall itself. Okay. Perhaps I'd like to take this time to share something a bit more memorable as a hall member. So what I really experienced back then was that I was the first responder to this incoming resident who was sort of unconscious in the van. So being a physio, okay, we are trained in CPR, we are trained in how to respond to emergency situations, but that didn't come to me as something that I may need to use. Okay, so when I saw this brother of mine in the hall itself, okay, he was unconscious. The security guards were just there looking aimlessly as, okay, what am I supposed to do? First thought that came in was, how do we react to this situation? So immediately I got my fellow hall members to grab the blood pressure machine, grab the glucometer to check his blood sugars, okay, lay him down in a flat position, elevate his legs, okay, while calling for the doctor to come. So thankfully, it was only a heat exhaustion. So this guy recovered very nicely without the need for escalating his care to the hospital. Something that I thought was a bit dear to me because it was so hot that day. I came out, my scrubs were all wet. I was soaked, my gloves were all soaking with water inside there. But I could even contribute to a small, if I could contribute to something like that, it really makes me feel that, okay, it's very worthwhile volunteering for these 2 months. Okay, so this is the last picture, and this is probably the last 2 days of our deployment down there. It was really a 2 months worth of sort of enjoyment, but at the same time has its challenges that come. So I would like to leave the incoming healthcare professionals to say that being in healthcare, of course, has its challenges. There are many things that you may not expect or school does not teach you, but come with an open mind, be positive. Every day has its fair share of issues, be it dealing with difficult family members, dealing with difficult patients. But if you can provide something that will change their life, okay, this is something that I hope that you try to achieve every day when you come to work. Okay? So thank you so much for listening in. I come to the end of my presentation.
Thank you, speakers. Thank you, Jowly, Agnes, Giselle, and Aloysius. We'll come to a time of Q&A. So before we start with the Q&A, we really want to give a shout out to all healthcare workers for all the commitment and all the sacrifices that you had to make during this whole COVID-19 pandemic. And that being said, also definitely those people on the back end, people at IHIS, those helping with contact tracing, and all the various things that helped us be where we are today in our current situation in Singapore. No doubt we are still in this whole we are still in the current pandemic, but we can actually kind of see the light in probably a few months or a year plus, probably. I'm not too sure, but it's good that we can see that things are getting better, and it's really due to the healthcare workers. Yeah. So I would like to just start off the time with asking Jowly the first question. So Jowly, what are some of the key challenges of your day-to-day work, and what was the job environment like when you were managing the back-end operations of COVID-19?
Okay, in healthcare, it's a very fast-paced environment, and we were being asked to make changes to the systems on a daily basis during the COVID-19 operation. So sometimes when we discuss certain workflows for the applications in the morning, and we started to work on the application changes. And then in the afternoon or maybe the next day, things start to change because policy change or protocol change. So we have to react very quickly to the change in business needs or operation needs. So we have to be very agile and be adaptive to all these changes and be open-minded about it. Don't just, yeah, you told me that this is the way it should behave, then you change the way it is now. So I think we have to keep an open mind when we are supporting the operation of COVID. We also have to be able to implement the solutions at the shortest possible time and at the lowest cost, because we know COVID is a time where a lot of money will be spent, and we would need to also be prudent on our spending on the application development. So after we have done the development, then we have to find effective ways to maintain and manage the applications to last it for different halls openings, as well to extend it to different CCFs like Tuas South or to DB blocks. So actually it's a very challenging but very rewarding experience when I'm supporting COVID.
Thank you, Jolly. Next question is for Giselle. So what do you like the most, and also what do you like the least about your current role in managing COVID-19? So what you like the most and what you like the least.
Okay, for the most I like is when I have conducted a lot of training and the educations, and the people, even the laymen, they have understood better for the infection control knowledge. Then they are willing and they are proactively like want to take on that knowledge and practice on themselves, and they take it seriously. So I'm happy that I can contribute on this part and improve the awareness, including our own healthcare workers and the public.
Thank you, Giselle. Next question we have for Aloysius. So I think just now you really shared on your volunteering experiences, and I think you also shared on your memorable stories. But other than that, do you have any other interesting or memorable stories that you want to share with us?
I think definitely there are quite a lot available. So maybe I share one more, which is how we try to engage the brothers inside the hall. So they are all quarantined inside there 24/7. Okay, back then when we first started, it was until they had 2 negative swabs. Then gradually the restrictions and the regulations changed, that the moment they hit 21 days, out they go. Okay. So back there, within 24 hours, okay, they're stuck in that box. It's a very big box, I would say, but they really had nothing to do. Some of them, they were so afraid. They just didn't want to go out and interact with anybody. Okay. Some of them were just sitting down beside the Wi-Fi box, playing with their phone. Okay, that's what everybody does. But we were trying to figure out ways on how to engage them, so we had to crack our heads, come up with ideas or come up with even games to play. But there comes our next challenge, where how can we get them to come out and play games? Okay, that's something that we had to come out, and we had to get whatever snacks that we have inside that were for us. We brought it in for them. Okay, so we brought it in, we used that to tell them, okay, if you come and play with us, it helps you to interact with your other friends over here, but you could also get something, an extra snack to eat. So this is something that I think we managed to get them to come. But comes to another issue, which, because it's a very big expo hall and everyone inside there were from different countries. So you had the Thais, you had the Bangladeshi, the Indians, the Mien, those from Burmese, then from China as well. So everyone speaks a different language. How can you get everybody down? So that's where it comes to knocking their door, asking them to come out. But what I really like to see is also how some of them are very proactive. Although they don't speak each other language at all, all they knew was 1 or 2 phases of each other languages. Like the Bangladeshi guy can come over to the Chinese guy, say, lai, 1. That's all they did. But it got these Chinese brothers or Chinese foreign workers to come and play with them, something that is just very rare. So these are interesting stories and very heartwarming inside the hall, which if you don't see it for yourself, I think we are just here to share with everybody that, okay, although they thought, hey, what y'all do inside there for 2 months, really got nothing much to do. But in fact, there's quite a bit of activities that we have to think of, not just go and take care of the residents, ask them to check and key in the blood pressure readings 8 times a day lah. Yeah, so that's about it.
Thank you, Aloysius. That's a very heartening story. Nice to hear. Okay, next question we have for Agnes. So, is there such thing as an epidemic or infectious disease nurse now? Because we think that such nurses are very specialized with such isolation techniques.
Okay, so I would say that all nurses or all healthcare professionals who are involved in caring for patients with COVID-19 or in the front line are actually all epidemic and infectious disease nurses. Because I think like Giselle, she's an infection control nurse, right? So we all our institution have a infectious disease team, infection control team, where they actually equip us with or how to wear the PPE properly, how to wear the mask to protect ourselves, to protect our families and everyone around us. So I think as of now, right, every one of us are very, very good in wearing all these protective equipments and also to learn about the isolation techniques very well. Yep. So everyone is a infectious disease nurse. Yep.
Thank you. I'd like to pose this question to all the panelists because I do see quite a number of questions asking about mental well-being. We do know that this is a very long fight for COVID-19. It wasn't just a 1 or 2 month stint. It's been more than a year and it's probably going to be a few more years too. So the question is, how do you control and manage your emotion when dealing with such stress? And how do you deal with your mental well-being? Maybe we can get Giselle to answer first.
Okay, because I myself is infection controller, so I believe that like even at home or during the off days, so I will always practice my hand hygiene, always bring the hand rub, including my family members. So I just teach them the very common. I say this is just a very easy way. You just need to do it. This is part of your life. So in fact, I don't feel that is like very stressful in the current situation by adhering to like wearing the mask and also the hand hygiene. That's not an issue. Besides that, I myself I like to bake. So during the off days, I will bake some desserts or the breads for my family members and the friends.
Thank you, Giselle. Anyone else wants to add on?
Okay, I'll add. Okay, so in terms of managing stress, being a physio, of course, you all know what I'm going to say. Yeah, exercise is one of the strategies to actually improve your emotions. Okay, work on your physical activity, and which in terms will help to manage stress as well. So use exercise as one form of a stress relief, but don't over exercise. Okay, we've seen during circuit breaker how everybody just started to be a bit more active. Then when circuit breaker actually ended, the parks were less crowded. So I would like to encourage everybody to continue on to be active, be it even changing your routine to walk one extra bus stop rather than take the bus down. Okay, it will save you some money and it will work on your fitness as well. A short change in your life will actually go a long way down the road. Okay.
Thank you, Aloysius. Okay, moving on to Agnes. Being a professional nurse and with the current pandemic, what advice would you give to the young graduates who will be helping in the front line as a nurse? So I think they meant how to deal with patients' emotions and how to handle their own emotions.
Oh, okay. So how do we deal with patients' emotions? I think firstly we have to deal with our own emotions first, because sometimes, right, when you work in this type of environment, it may be very overwhelming. There's a lot of things for you to do, so you need to have very good multitasking skills. That's number one. And then you need to know how to manage stress, okay, which is adding on to, I think, the earlier questions. That self-care is really, really important. If you really need, you can talk to your friends, your family, or maybe your colleagues who have similar encounters of a situation that you encountered before. Like example, earlier I talked about patient passing on, when we witness patient passing on, and sometimes it is the first time if you see a patient passing on, it might be quite traumatizing, or you might keep thinking about it. So sharing the experiences is really very important. Only once you are able to actually handle your emotions better, then you can actually speak to your patients. So sometimes, like if the patients are very sad, you can actually help to comfort them, and they can also share with you. So you just really talk to them like a friend. That will also alleviate their stress, because in the healthcare sector, if a patient is admitted, right, sometimes they are very scared. They don't know what to do, and it's a very new environment. So many pumps beeping around them. Everyone is walking so fast, so they might be a bit scared lah. So we can like, help to alleviate some of their concerns then. And for young graduates who are really interested and passionate about working, just I think one of the most important things is come with an open mind, because healthcare itself is very challenging. Every day it is very different. You cannot anticipate. It's not a routine thing. Although sometimes the work are kind of like routine, but situation change. So we need to really come with an open mind, and then to adapt the changes lah. I think that will be very helpful.
Thank you, Agnes. This question is for Jowly. So we have SARS and now dealing with COVID. Do you think, hopefully not, but do you think we'll be in a better position to tackle the next crisis in terms of back-end health technology-wise?
Right. I'm very confident that we are more prepared than the SARS time for COVID, because back in SARS, I remember I was quite young, but I'm already working. So back then, the SARS was only for a period of maybe 6 months, and it was over. So the impact to everyone's life is not as much as COVID, which has lasted for a year plus and still counting. On our applications-wise IT landscape, we are definitely more prepared, and we are ready to be activated and go into action to manage another pandemic, which I hope it will not happen. But if it really happens, we are ready to jump into action. And I'm sure I have the backing of all the healthcare workers that they are also ready to go into actions if called upon. Yeah.
Thank you, Jowly. Okay, next question is for Aloysius. Being a physiotherapist, what are some of the challenges that you have faced that you find it hard to overcome in the current pandemic? And what advice would you give to students pursuing this field?
So being a physio now, in my current work area, I deal a lot with patients with chronic disease, and usually exercise has the ability to reverse or to even slow down the chronic conditions that they are having. What I really see in some of my patients is finding options for them to engage in physical activity or engage in something meaningful that will impact their health. So the challenge is to find something or find an option for them that they will like, because gyms are closed, fitness corners were closed back then. They can't even go out, or they're even too scared to go out. So we had to come up with different options or work together to figure something out that they could do safely, okay, and really make sure that could create a difference for them. So that was probably the challenge that I had, okay. And also for the entire department, we had to move a lot of our consultations virtually. I personally haven't had the experience of moving my consultations virtually because I was deployed to Expo then. But I know a lot of my colleagues are trying to come up with different criteria to work on video consultations. So this has definitely reduced the need for patients coming down, especially for those with, say, with difficulties even leaving the house. So for those that have breathing difficulties, you walk a few steps, that's it. You let alone come to the house, they take 2.5 hours. If they can do a video consult, okay, if they're tech savvy enough to do a video consult, this will definitely improve their physical tolerance back home, reduce the need to travel up and down, which takes up a couple of hours, including their rest breaks. So they can engage in more meaningful interventions from us, then it overall also improve their health. Yeah, but this is probably the biggest challenge that I faced so far and still facing it because people are still not really. I have just had one patient came in 2-3 days ago, and yeah, she was that afraid to even take the lift down 18 stories. So these are things that we have to consider other options and still trying, still don't have the right solution. So definitely, if I get something, I'll share again lah.
So what is the take-up rate? I'm not too sure whether you have done any of the tele health. So if so, what is the take-up rate and how do you conduct such sessions?
So I haven't done the video consults personally myself, but I've seen my colleagues doing them. Usually the criteria is very strict. So they need to be well versed in English, need to be tech savvy. Okay, there needs to be somebody back home in case anything happens. So after that, what we do is that a lot of them is based on education. We can't touch them. We cannot do a very thorough physical examination. So we focus a lot on education, motivation, motivational interviewing to get them to change their lifestyle for the better. Then subsequently, if they're able to create a change themselves, the next time when they see us in person, we can do more things with them, which makes the session more meaningful. Then they won't have to make an extra trip. When they come in, they only do a consultation with us because they haven't started anything at all. But if we could reduce the need by doing a video consult with them, and the next session they come and see us, we could do a treadmill test with them, or we could really go down hands-on with them. Then you can see that this reduces the need for them paying an extra charge for the transport, reducing the need to travel all the way down to hospital, and can maybe also improve their condition quicker. Yeah, so this is what I've seen so far with the video consults.
Thank you, Aloysius. How about Agnes or Giselle? Have you all helped patients through technology with telehealth or any such consultations?
I think for nursing, because we are in the wards, so there's not so much of tele communicating or anything like that for now, because most of the things that we have to do is really for the patient and all more skill based.
Yeah, for my part is we only do one time. Is during that time the number of the training, the number of people need the training is a lot, and we need the safe distancing. It's only one virtual training. So far, we always come to the site. We go to the site and conduct all the training. So not much experience on virtual experience.
Question is, during the heat of the pandemic, did you all ever question your choice of becoming a healthcare worker? If you all did not question, what was the motivation that was behind your perseverance? Agnes, would you like to go first?
Yep, sure. Definitely there are a lot of tough times, I must say. Not of course the pandemic is tough, but pre-pandemic nursing itself is also tough lah. Nursing is really not for really the faint-hearted, yeah. But I must say that for myself, right, in my 5 years journey, there are times that really I question myself, like, oh, why I become a nurse? Because sometimes I meet difficult patients, difficult family members, or like the situations that I shared earlier, where you do your best and you just can't understand why that the best effort that you give, right, just didn't have the outcome that you wanted. But a lot of times, like, we have to know that, like, in life, you cannot get everything to be perfect. Okay, so I guess that what really brings me back to my nursing profession is I'll always remember why I wanted to join nursing, to really just help people to the best of my efforts, and just to encourage them, and knowing that there are still nice patients around, nice family members who really appreciate your care. And in the recent years, I've been really talking to nursing students who then I realized that I have sometimes in the career you lost the passion, or you lost why you really started out in your job. And talking to them really makes me think of, yeah, at the start, why did I join nursing? So I think that's what really keeping me going. And also I have really very supportive friends and family, which is always very supportive. Like if I feel that's quite tough, then they'll listen to me. And I think yeah, that's yeah.
Anyone else would like to add to this question? Jolly, would you like to add to the question?
I think the work we are doing, although I'm not a frontline worker, as in I'm doing the IT system, but whatever system that we have implemented, we see that the system is able to help the frontline workers do their job better. I think that is something that is very encouraging, and it motivates me to think of new ways to help my fellow colleagues at frontline to do their work so that they can help their fellow the patients. So that is something that I think you will not get from other jobs. I have been through other jobs before, and this is one of the jobs that I think it is really fulfilling to see that whatever we are doing is making an impact to the care of the patients. And seriously speaking, we will one day be in the system and we will need the healthcare that we are building for others. So this is something that I think is important to remember.
Thank you, Jolly. I'll proceed on to the next question. I'm not too sure whether you all have the answers to this, but it could be more of a personal comment on that. So when do you think we can go back to some form of normalcy? And how do you think the new normal will look like?
Maybe I just chip in here. As you know that we have started the vaccination operation, and in fact, IHS is activated to support the VaxOp also. So in my opinion, as long as we are able to get most populations vaccinated, we will go back to some form of new norms. And new norms doesn't mean that we are going to be behaving what we are doing. For example, now working from home is something that is a real thing. Previously, we are not open to such a concept, but now it becomes such a normal things that the first thing when we come to our mind to do meetings is through Skype or Zoom. So it's difficult to imagine to having to get people gather around into a room to have meetings. Telehealth is another option that is very real that we are able to explore. So with today's situation, we are forced to explore all these technologies. So the take-up rate for all these things would certainly go up after the pandemic.
Thank you, Jolly. Anyone else wants to add to this question?
Yeah, I would like to add on for the new normal. New normal will be different from before COVID. For example, like hand hygiene, like washing our hands, disinfecting our hands. So the new norm will be like we are used to doing the hand hygiene not only before COVID, like only like before eating, after going to the restroom. It will be more frequent and it's very common in our daily life, even not in the healthcare setting. And the other thing is our respiratory care. That means wearing the mask. We are more aware that, you know, even you are not wearing the mask at home or with the gathering with the friends, you are more aware that you should cover your mouth and you should not, you know, let the whatever droplets from your sneezing, from your talking, to be like, you know, contaminate the environment. I think these two will be still carry on even we are back to the new normal.
would just like to add on to what Giselle said. I think with regards to our own hygiene, because I think previously when we were working, at least for myself, when we were working, if we were feeling a little bit sick, like with runny nose or a bit of cough, we'll still go to work because we thought work is more important. But now we actually do note that, okay, if you are feeling unwell, you do need to stay home. You do need to take your medical leave so that it's not because it's more because you do not want to spread it to other people. Because last time I remember there will be seasons whereby, oh, a lot of people in the office, they are down with flus and things like this. So we with COVID actually gave us more, it's a higher, we actually got to understand this better, and also we are able to manage ourselves better in that sense also. So we have time for one last question. I would like to go round with all four speakers and ask whether you guys have any words of advice for students who are aspiring to be part of the healthcare sector, whether is it frontline or also backend. Yeah, maybe we can go with Aloysius first.
Okay, so some words of advice is don't give up. It's going to be a very challenging experience, especially for those coming to study allied health. So it's a 3 to 4 year degree program, be it locally or overseas. It's going to be tough. It's a big change to expect. You will experience failure somewhat, be it in your university life or even in your working life. This is normal. Okay, even for me, I failed my tests, failed my audits, but it's how we move on. Okay, and why do we move on? So that we can improve the care of our patients, be a better clinician, and hopefully try to strive it out in the community out there one day lah. Okay, so don't give up, continue on to work hard and be open. Thank you.
Thanks, Aloysius. How about Agnes?
Okay. For me, I think that if they're interested in healthcare, just go for it. Okay, if you have the passion for whichever areas, you just have to go for it and try it out, because I think Aloysius has mentioned nothing is really easy. Everything is very challenging, especially if anyone who is aspiring to become a nurse. Okay, I can tell you that the job is really, really tough. Okay, I'm not trying to shun you away, but this is the reality. You must be able to learn. Anyway, every day is a learning experience. We learn from our mistakes. We learn from what we don't know. And most important is always remember why you want to join healthcare. Actually, it's to help people to really save lives. So yeah, something for us to remember lah. And most importantly, you need to learn to be resilient. But this everything you can learn along the way, because when I first started out, I'm also very new to the career, and I also learned throughout my 5 years in my career, bits and pieces, and slowly I build up my resilience, and I learned a lot of things along the way lah. A lot of small things already added up to a very big thing. Yep. Thank you.
Thank you, Agnes. How about Zhao Li?
Yeah, you must always remember why you join healthcare. That would always keep you in the job, because you join healthcare to help others. And for me, I want to implement systems that I am able to let my frontline healthcare workers use to help the patients. So with that objective, I would always make sure that I put in a system that is useful and not just for the sake of doing the system. So always remember why you join healthcare. Yeah.
Thank you, Zhao Li. Last but not least, Giselle, do you have any words of advice?
Okay, apart from the sharing from Agnes, yes, yeah, the first few years of the nursing, you will go through a lot of tough time because you need to have a lot of experience at the ground. So I just want to share some experience after being a nurse for more than 10 years. I think the nursing is really an amazing job. So please stay positive, because you will find that, you know, there are a lot of good colleagues working together with you, the doctors, the allied health care workers. We have a very good teamwork at most of the healthcare setting. And as long as you apply your knowledge, your experience, just learn as much as you can. You will find a lot of fun and a lot of joy in nursing, and you also have a lot of choices like Agnes shared. Like, you know, nursing actually not only just something that you have seen. There are a lot of others like research, like infection control, and like education. Yeah, so please carry on.
Thank you, speakers, for your insightful sharing. We have come to the end of the session and hope that you have benefited from this sharing. If you have enjoyed this session, please take a few seconds to rate this program at the bottom left of your screen. So our next section is Dare to Care, a call to our future scholars tomorrow at 27th of Feb at 10 a.m. So join the Healthcare Scholarships team for this information session to know more about making a difference with healthcare scholarships. In addition to the overview of the scholarship schemes offered, you are able to interact and hear from our administration, medical social work, diagnostic radiography, and nursing scholar ambassadors, scholarship officers, and representatives from the various public healthcare institutions. We look forward to seeing you in our upcoming sessions and have a good Friday evening. Thank you, everyone.